Lydia McRoberts, the dietitian here at Renew Health Chiropractic.
And I'm Dr. Samantha, the chiropractor here, and we wanted to talk to you about sleep today.
Very important sleep, right? So with sleep, obviously there's so many factors that can influence your sleep quality, the amount of sleep you are getting in a night. But there's a couple of key takeaways that we really want to, that are in your control, that would be easy things for just overall better health. So from a nutrition standpoint, a lot of people, get all cozy at night and get their bag of chips or their cookies or ice cream or whatever, and then within an hour, 2 hours, they're going to sleep. That is one thing that is an easy, quick fix, that a habit that is really good to break, the late night snacking. So your blood sugars stay consistent through the night, and the quality of your sleep also can be improved by that as well.
Yeah, so at least 2 hours before you go to sleep. You really don't want to be eating anything after that 2 hour mark, as well as blue light and screen. You really want to reduce that at least an hour before you go to sleep. When it comes to your sleep cycle, the wake to rest cycle had a lot to do with the light that we have with the sun back in the day before we had screens. So your body needs at least 1 hour to start regulating that sleep cycle and releasing melatonin. So if you're constantly on your screen and your eyes are constantly getting that light, it's really hard for your brain to understand, okay, we got to start going to sleep, because you have that constant stimulation of light, and it's really from going to light to darkness that your brain senses, and it starts to release that melatonin. Another fun fact about melatonin, Turkey Day, how everyone feels so much sleepier after they eat turkey? Well, that's from tryptophan. Tryptophan is an amino acid that if you do not eat, your body cannot produce. So you need to eat tryptophan foods, which is just really in the same vein as nutrition. Like, are you eating really high quality proteins or food sources that have those amino acids that your body can't make and needs to have supplemented from your diet? The other thing chiropractically that you can do to help support your body through sleep is take a look at your mattress and take a look at your pillow. Are they older than your children? Do they have a little divot, like a little nook that you slide into and can't really move around from? Your pillow, is it keeping your neck parallel and neutral, either in the back resting or side resting positions? And hopefully you're not a stomach sleeper. If you're a stomach sleeper, we need to talk. It's bad. Yes.
And Dr. Sam, what do you do to wind down at the end of the night?
I personally drink my sleepy time chamomile tea. That really helps me just get cozy, and I like to read books, so I'm away from my screens, or I'll even have a podcast in the background as I get work done right before bed. What about you? What do you like to do?
Definitely a tea drinker, especially when it gets cold outside. Get my tea and sometimes put a fire on, and wind down with my husband and just kind of talk through the day, and then go to sleep.
Yes, and what a good way to go to sleep, with good happy thoughts rather than poor thoughts ruminating and stressful thoughts ruminating in our brain. So hopefully this helped. If you have any questions, please talk to either myself or Miss Lydia here.
So get off your phone an hour before at least and go to sleep.
And no late night snacking. Thank you.